Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear an allergist talking to a patient called Mr. Johnson about managing worsening asthma. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Johnson. How are you feeling today?
Good afternoon, doctor. Honestly, I'm not feeling great. My GP referred me to you because I've been having these persistent symptoms that seem to get worse whenever I'm at home. We recently adopted a dog, and I think I might be allergic.
I'm sorry to hear that. Can you tell me more about the symptoms you've been experiencing?
Sure. It started with just a bit of sneezing and a runny nose, but it's gotten worse over the past few weeks. Now I'm dealing with constant congestion, itchy eyes, and even some wheezing, especially at night. It's like my chest feels tight, and I'm short of breath. It's really uncomfortable, and I'm not getting much sleep because of it.
That sounds difficult. Have you noticed these symptoms improving when you're away from home, or do they seem to persist regardless?
They definitely get better when I'm out of the house. If I spend the day at work or anywhere else, I feel a lot better. But as soon as I get home, within minutes, I start sneezing and my nose gets all stuffed up again. I hate to say it, but I think it's the dog. My wife and kids are really attached to him, though, so I don't know what to do.
It's understandable that you're concerned, especially if the symptoms are affecting your quality of life. Based on what you've described, it does sound like you might have a pet allergy, specifically to dog dander. Allergies to pets are quite common, and they can cause the exact symptoms you're experiencing: nasal congestion, sneezing, itchy eyes, and respiratory issues like wheezing.
I was really hoping it wasn't that. We've only had him for a few months, and I didn't notice any problems at first. Is there anything we can do to manage this, or am I going to have to think about rehoming him?
I understand how difficult that decision would be. There are several steps you can take to manage your symptoms and still keep your dog. The first thing is to minimize your exposure to allergens. This includes things like keeping your dog out of your bedroom, using HEPA air filters in your home, and regularly bathing and grooming your dog to reduce the amount of dander. It's also important to clean frequently, especially vacuuming carpets and furniture where pet dander tends to accumulate.
We've been trying to keep the house clean, but I didn't think about using a special filter. I'll definitely try that. Is there anything else that could help?
Along with environmental controls, medications can be very effective. Antihistamines can help reduce symptoms like sneezing and runny nose, and nasal corticosteroids can alleviate nasal congestion. If you're dealing with more severe symptoms like wheezing, we might consider prescribing an inhaler to manage that. Another option is allergy shots, or immunotherapy, which can help reduce your sensitivity to pet allergens over time.
Allergy shots? How do those work?
Allergy shots or immunotherapy involve injecting small amounts of the allergen, in this case, dog dander, into your body over a period of time. The goal is to gradually desensitize your immune system to the allergen so you don't react as strongly when you're exposed to it. The treatment usually starts with weekly injections, and then the frequency decreases as your tolerance builds. It can take several months to a few years to see significant improvement, but many people find it very effective.
That sounds promising. But in the meantime, will I need to avoid the dog as much as possible?
It's best to limit direct contact with the dog as much as you can, especially until we get your symptoms under control. You might want to have someone else in the household take care of tasks like feeding and grooming the dog. But with the right combination of environmental changes, medication, and possibly immunotherapy, there's a good chance you can manage your allergy while keeping your pet.
I'm really relieved to hear that. The kids would be heartbroken if we had to give him up, and honestly, I've grown attached to him too. I'm willing to do whatever it takes to make this work.
That's great to hear, Mr. Johnson. It's clear that your family's happiness and your health are both important to you, and we'll do everything we can to help you manage this allergy. Let's start by confirming the diagnosis with an allergy test, either a skin prick test or a blood test, and then we'll come up with a comprehensive plan tailored to your situation.
That sounds like a good plan. Thanks for your help, Doctor. I feel a lot more hopeful now.
You're very welcome. We'll work together to ensure you can enjoy your time at home with your family and your dog without the discomfort of allergy symptoms. Let's get started with the testing.
Extract 2, questions 13 to 24. You hear a podiatrist talking to a patient called Mr. Davies. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Davies. Thanks for coming in today. This consultation is an opportunity for us to discuss your concerns and work out a treatment plan for your toenail issues. How have things been going?
Morning, Doctor. Well, to be honest, not great. My toenails have been looking awful, for lack of a better word. It's embarrassing, especially with sandal weather. They've gotten thick, discolored, and kind of brittle over the last few months.
That sounds frustrating. How long have you been noticing these changes?
It started a few months ago, but I ignored it at first, thinking it was just something minor. I thought they were bruised or maybe I hit them while exercising. But now they look yellowish, and I can't even trim them properly because they've gotten so hard and thick.
It sounds like you could be dealing with onychomycosis, commonly known as toenail fungus. It's a fairly common condition, especially in toenails, but it can take a while to develop and often doesn't go away without treatment. Have you noticed any discomfort or pain?
Actually, yes. It started hurting a bit a few weeks ago, particularly when I'm wearing tighter shoes or if I bump my toes. The nails seem to be lifting slightly from the nail bed, which is kind of concerning.
That makes sense, especially with the thickness and discoloration. Nail fungus can cause the nails to separate from the nail bed, which can sometimes be painful. Do you remember if you had any injuries to your nails or if they've been exposed to moisture for prolonged periods, like after swimming or showering at the gym?
Now that you mention it, I'm at the gym regularly, and I often use the public showers there. I don't always wear flip-flops, so maybe that's where it came from?
Public showers and pools are common places where people pick up nail fungus, so it's possible that's the source. The fungus thrives in warm, damp environments, so places like that can lead to infections, especially if the nails are exposed or weakened.
That makes sense. I didn't realize how easy it was to catch. Is there anything I can do now to prevent it from spreading?
Definitely. First off, it's good you came in for treatment. We'll go over some options shortly. In the meantime, try to keep your feet dry as much as possible. Change your socks regularly, especially after exercising. Also, make sure your shoes aren't too tight, as that can trap moisture and exacerbate the issue. As for the gym, it's essential to wear flip-flops in public showers to minimize contact with potentially infected surfaces.
Got it. And as far as treatment goes, what are my options? Can I just use one of those over-the-counter creams?
Over-the-counter creams and treatments are available, but for more advanced cases like yours where the nails have thickened and started to lift, it's often more effective to use prescription treatments. These could include topical solutions or oral antifungal medications. The oral medications tend to be more aggressive as they target the fungus from within, but they do come with some potential side effects that we'll need to consider.
Are there any risks I should be aware of?
Yes, oral antifungal treatments can occasionally affect your liver, so we'd likely need to monitor your liver function with blood tests if we go that route. Topical treatments, while safer in terms of side effects, can take a lot longer to show results, and they may not penetrate the nail deeply enough if the infection is well established.
I see. That sounds like quite a process. How long does the treatment usually take?
Unfortunately, nail fungus isn't something that clears up quickly. Depending on the severity, treatment can take anywhere from several months to a year, especially since toenails grow so slowly. We'll have to be patient. The good news is that with consistent treatment, it's possible to get rid of the fungus, and the nail can eventually return to its normal state.
A year? Wow, I had no idea it took that long.
Yes, I understand it sounds discouraging, but the key is consistency. Stopping treatment too soon is one of the most common reasons the fungus comes back. So, even when the nail starts looking better, it's crucial to complete the entire course. There are also newer laser treatments that some patients opt for, which can help speed up the process. But they tend to be more expensive and aren't always covered by insurance.
I've heard about laser treatments. Are they effective?
They can be, especially when combined with traditional treatments. The laser works by targeting the fungus underneath the nail, and some studies suggest it can reduce the infection more quickly. But again, it's not a miracle cure. You'd likely still need to use a topical treatment alongside it. We can discuss this option in more detail if you're interested.
I'll have to think about that. It sounds like a lot to consider.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional explaining a diagnostic procedure to a colleague. Now, read the question.
Mrs. Davies really shouldn't be increasing her activity just yet.
Well, it's only a short walk around the ward, and she's been improving, so.
She can manage small tasks like sitting up and walking a few steps with assistance, but that doesn't necessarily mean she's ready for longer walks.
She's getting a bit frustrated being confined to bed, and she wants to regain her independence. She's been asking to move more.
I understand, but we need to prioritize her recovery. She may feel ready, but I believe she's still at risk of overexerting herself right now.
I can stay with her during the walk if that would make you feel better.
I prefer if she continues to limit her movement until we get the physiotherapist's clearance. We don't want to compromise her recovery for a little extra movement.
Now look at question 26. You hear a medical professional explaining a survey on patient feedback. Now read the question.
And satisfaction survey, and I'm sure many of you have your own thoughts and ideas on how we can improve things going forward. There's no denying that patient feedback is essential for enhancing the quality of our services, but of course, any changes need to be managed thoughtfully and efficiently. I've heard concerns from some of you regarding the new feedback system, specifically about whether it might create additional paperwork and take valuable time away from direct patient care. I want to reassure you that we've implemented a streamlined process, one that minimizes any extra time spent on administrative tasks. The system has been designed to seamlessly integrate into your current workflow, minimizing disruption. Additionally, managers will closely oversee the rollout to ensure it runs smoothly. We'll also be providing training sessions so that everyone feels confident and comfortable using the system. Hopefully, that helps put your mind at ease about the upcoming changes.
Now look at question 27. You hear her discussing with a doctor about Mr. Johnson. Now read the question.
Would you mind if we took a moment to discuss Mr. Johnson in room 3?
Of course. Is something wrong with him?
Not exactly. The physiotherapist had asked me to speak with the patient's son regarding his mobility situation. Specifically, I had to explain that Mr. Johnson's condition has deteriorated to the point where he may never be able to walk again without assistance.
That must have been a difficult conversation. How did it go?
Honestly, it was awful. His son kept asking me if there was any possibility for improvement, hoping for some encouraging news. I didn't know how to answer that, and it made the whole conversation incredibly tough. The situation was so upsetting. I could feel my voice shaking as I tried to get through the discussion. It was such an emotional moment for both of us, and I really don't know if I handled it as well as I should have.
I completely understand. It's always very challenging to have those kinds of difficult conversations with families.
Now look at question 28. You hear a discussion between two people. Now read the question.
I've just reviewed the notes for a 45-year-old woman in Ward 3. She's been experiencing persistent headaches, and neurology has requested an MRI of her brain.
Do you think that's necessary right now?
I was considering whether a head CT might be quicker. It's less sensitive than MRI, but it could still show anything major like a bleed or a tumor.
But what about the radiation exposure with the CT?
True, but a single scan shouldn't be harmful. However, MRI doesn't use radiation, which is an advantage.
Is there any drawback to the MRI?
The main issue is the time. It takes longer to perform, and it can be difficult for patients to stay still.
Right. If the CT doesn't give us enough information, we could always follow up with an MRI.
Agreed. I'll let neurology know we suggest starting with a CT, but MRI is a backup.
Now look at question 29. You hear a physician explaining over prescription. Now read the question.
If we closely assess the risks associated with administering antibiotics unnecessarily, we can clearly see that overprescription has significant long-term impacts, especially when compared to targeted treatments. It's obvious that our primary focus should be on reducing unnecessary antibiotic prescriptions, which is a crucial step in the fight against antibiotic resistance. Thankfully, here at our facility, our antibiotic stewardship program has already led to a measurable reduction in resistance rates. Currently, our resistance rate is down to 10%, which is a notable improvement compared to the national average of 18%. Many of the patients I see regularly are older adults, many of whom have chronic health conditions that place them at an inherently higher risk for infections. However, indiscriminate use of antibiotics in these cases can lead to resistant infections, which significantly compromises the effectiveness of future treatments. The time we invest in ensuring that antibiotics are used only when absolutely necessary is not just important for the individual patient, it plays a critical role in protecting the broader population from the rise of resistant bacterial strains. Older adults, in particular, are especially vulnerable to serious complications when infections become resistant, as this can negatively impact their heart, kidney, and lung health.
Now look at question 30. You hear a GP discussing about Mr. Adams. Now read the question.
In some pain after his gallbladder removal. Will he be transferred to the ward shortly?
Yes, I'm just about to arrange that. He should be heading up within the next 20 minutes.
All right. I've adjusted his post-op medication orders. There's a chance he might experience some post-operative nausea or even an infection, given the size of the gallstones we removed. It's crucial to monitor him closely for any signs of infection, like a high fever or increased pain around the incision. I've also requested a daily check on his liver function to ensure there's no bile duct obstruction. His vitals look stable, but I want to stay cautious.
Understood. I'll make sure the team keeps an eye on him for any post-op complications like infection or bile leakage.
Great. Let me know if anything changes or if you notice anything concerning.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on ringworm. You now have 90 seconds to read questions.
I'm Dr. Sarah Collins, a dermatologist specializing in skin infections, and I've spent much of my career studying ringworm, a common but often misunderstood skin condition. Despite its name, ringworm isn't caused by a worm. It's a fungal infection that affects the skin, scalp, nails, and feet. The infection appears as a red, circular rash with clearer skin in the center, giving it the distinctive ring shape that people recognize. However, the infection can present differently depending on the affected area, which can make diagnosis challenging. The spread of ringworm is surprisingly easy because the fungus thrives in warm, moist environments. It's highly contagious and can be passed through direct contact with an infected person, animal, or contaminated objects like towels, clothing, and gym equipment. Because of its infectious nature, outbreaks are common in places like schools, daycares, and locker rooms, where close contact occurs frequently. Unfortunately, the stigma associated with the condition often leads to delayed treatment, as people may not seek help due to embarrassment. One of the key problems I've observed is that ringworm symptoms can vary significantly, often mimicking other skin conditions such as eczema, psoriasis, or even allergic reactions. For example, on the scalp, ringworm can cause scaly, bald patches that are often mistaken for dandruff or other dermatological issues. This misidentification means people might use ineffective over-the-counter treatments, allowing the infection to persist or worsen. Recognizing the specific appearance of ringworm and seeking appropriate antifungal treatment is essential to stop its spread. Treating ringworm effectively depends on early detection and correct application of antifungal medications. Topical treatments such as creams or ointments are usually sufficient for mild cases, but more severe or widespread infections, like those on the scalp or nails, may require oral antifungal medication. I always advise patients to complete the full course of treatment, even if the symptoms improve quickly. Discontinuing medication too early is one of the primary reasons for recurrent infections, as the fungus might not be completely eradicated. Preventative measures are also crucial in controlling ringworm. These include maintaining good hygiene, regularly washing hands, keeping skin dry, and avoiding sharing personal items like towels and hairbrushes. It's also important to clean and disinfect surfaces and objects that may harbor the fungus, especially in communal environments. Pet owners should be vigilant, as animals, particularly cats and dogs, can carry and transmit the infection without showing obvious symptoms. A common misconception is that only people with poor hygiene get ringworm, but that's simply not true. The fungus doesn't discriminate. It can affect anyone, regardless of their cleanliness. People involved in sports like wrestling or swimming, where close contact and shared facilities are common, are at a higher risk. Moreover, individuals with weakened immune systems, such as the elderly, young children, or those with chronic illnesses, are more susceptible to infection and may experience more severe symptoms. Let me share the case of a young athlete named Jake, a 16-year-old wrestler who came to my clinic with a red, itchy rash on his arm. Initially, Jake thought it was just a reaction to his workout gear, but the rash quickly spread, and his coach insisted he see a doctor. When Jake came in, it was clear that he had a classic case of ringworm, exacerbated by the sweaty environment of the wrestling mats. Fortunately, with early intervention and antifungal treatment, Jake's condition improved within a few weeks, but it required strict adherence to treatment guidelines and some lifestyle adjustments to prevent recurrence. Jake's case is a stark reminder that ringworm should never be dismissed as a minor irritation. Left untreated, the infection can lead to more serious complications, like bacterial skin infections due to scratching. Furthermore, because Jake continued to wrestle before seeking treatment, several of his teammates also developed similar symptoms, highlighting how quickly ringworm can spread in group settings. This outbreak was a wake-up call for the entire team, emphasizing the importance of early recognition and immediate treatment of any suspicious skin conditions. In conclusion, while ringworm is highly treatable, the key is awareness and prompt action. Education about recognizing symptoms and understanding the risks of untreated infections can prevent widespread transmission. We must break the stigma around skin infections and encourage people to seek help without delay. Remember, ringworm doesn't reflect personal hygiene. It's simply an opportunistic infection that anyone can catch.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Rachel Simmons discussing age spots. Now, read the questions. You now have 90 seconds to read questions. We're joined today by Dr. Rachel Simmons, a dermatologist with a special focus on age spots, also known as liver spots. Dr. Simmons, can you start by explaining what age spots are and how you became particularly interested in this condition?
Age spots, or liver spots, are flat, brown, grey, or black spots that usually appear on sun-exposed areas of the skin, such as the face, hands, shoulders, and arms. They're caused by an overproduction of melanin, the pigment responsible for our skin color, and are primarily associated with prolonged sun exposure over the years. My interest in age spots started during my residency, where I encountered numerous patients concerned about these spots not just from a cosmetic standpoint, but also because of the confusion with more dangerous skin conditions, like melanoma. I've treated countless patients who felt anxious and self-conscious about their appearance due to these spots, and it became apparent how much this seemingly minor condition can impact one's quality of life. It was really personal experiences too. My own mother developed significant age spots, and seeing her distress made me realize the importance of not only treating but also educating about prevention and management.
What do you find most challenging about managing and treating age spots?
One of the biggest challenges is distinguishing age spots from other potentially harmful skin conditions, like skin cancer. For instance, I had a patient named Linda, who was 63, and came to me worried about a cluster of dark spots on her face. While they were eventually identified as benign age spots, Linda had spent months anxious, fearing they could be something worse. This highlights the need for proper diagnosis, as well as the psychological impact these spots can have on patients. Treatment is also a challenge because it often involves a multi-pronged approach. We have topical treatments like hydroquinone or retinoids, procedures like laser therapy and cryotherapy, but they all come with varying degrees of effectiveness and possible side effects. Managing expectations and helping patients find the right balance between effective treatment and maintaining skin health can be quite complex.
How do you approach treatment for patients who are particularly bothered by their age spots?
The first step is a thorough consultation to assess the spots and rule out any potential malignancies. For someone like Linda, once we confirmed they were benign, we discussed her options. I emphasized that the best approach depends on factors like the patient's skin type, the extent of the age spots, and their expectations. For those seeking immediate results, laser treatment or intense pulse light IPL therapy can be effective, though it can be costly. For others, topical treatments with hydroquinone or glycolic acid may be preferable, though they take longer to show results. I also stress the importance of sunscreen use as a crucial part of treatment and prevention, Protecting the skin from further UV exposure is essential to prevent new spots from forming and to ensure existing ones don't darken. It's a collaborative process, ensuring that each patient feels comfortable with their treatment plan.
Do patients ever express how these spots affect them emotionally?
Yes, often more than people realize. While age spots are harmless, they can have a significant emotional impact. Many patients, especially women, express feelings of frustration and self-consciousness, viewing the spots as a visible sign of aging. I remember another patient, Jane, who felt embarrassed by the dark patches on her hands and avoided wearing short sleeves or jewelry that would draw attention to her arms. There's a stigma attached to looking older, and age spots, though benign, can contribute to that feeling. I always encourage my patients to voice these concerns, and I make sure to validate their feelings because it's about more than just physical appearance, it's about how they feel about themselves.
Have you changed the way you approach patient care based on these experiences?
Absolutely. I had a patient, Tom, who was particularly upset about his age spots and had tried numerous over-the-counter treatments without success. He felt disheartened and even more self-conscious after every failed attempt. So, I made it a priority to not only provide the right treatment, but also to spend more time discussing realistic outcomes and addressing the emotional aspect of the condition. I now include a detailed consultation where we set clear goals, review treatment options in depth, and talk about the importance of sun protection. This approach has been very effective because it ensures patients have a comprehensive understanding of what to expect and feel supported throughout their treatment journey.
What would you say is the best way to prevent age spots?
Prevention is key when it comes to age spots, and it all starts with sun protection. I always tell my patients that using broad-spectrum sunscreen with an SPF of at least 30 is crucial, even on cloudy days or during winter months. Wearing protective clothing, hats, and sunglasses when outdoors can also help shield the skin from UV damage. Avoiding tanning beds is another critical point since they emit UV rays that can accelerate the appearance of age spots. For those already dealing with age spots, incorporating antioxidants like vitamin C into their skincare routine can help prevent further pigmentation. Early intervention and consistent protection are essential because once age spots form, they're much harder to treat. Prevention truly is the most effective strategy.
Thank you, Dr. Simmons, for sharing your insights on this topic today. That is the end of Part C. You now have 2 minutes to check your answers.